Julian tell you a little bit more. Julian, please.
Thank you so much, Ricardo. Hi, good afternoon, everybody. Cool, it's working. So it's kind of a hard act to follow someone who's just climbed Mount Kilimanjaro. But I can vouch for one thing, that what Jonathan said, that entrepreneurship, starting a social enterprise, definitely is always an uphill battle every day. And with that, I mean, some of my team members are here. They fight that same battle with me every day and help make Jaga-Me possible. So kudos to them, and also the Jaga professionals who are serving even right now, this very moment, there's care going on all across Singapore. But here today, I wouldn't call myself an expert. I'm just here to share a little bit about our journey, building a company that's helping to bring healthcare access to people all over Singapore and eventually the world. But here's the thing, when you think about healthcare, what's the first thing you think about? Right? If I could capture some of the instances that probably make this aggregate mental picture amongst all of us, you probably think about a GP, a general practitioner, or a clinic, or a hospital waiting room. But here's the thing, we need to take a little bit of a step back on what healthcare is and focus on what does healthcare mean to people. And I think, in my mind, healthcare is about helping people to live better, helping people live and age well. Healthcare is fundamentally about people, and for all the talk that's about robotics changing the way healthcare is done and jobs, I think people still eventually are the ones caring for people. I mean, if you fast forward yourself to what you envision your last 5 or 10 years of life to be like, you probably want to be thinking about how you can be independent. Perhaps some people were thinking about how they would be spending time and enjoying the company of your family and friends. So really, people care for people, and that's what makes healthcare healthcare. And I just wanted to share a little bit of a story with you, my own personal experience surrounding my own late grandfather. Why this makes a big difference to myself in Jaga-Me, as Jonathan mentioned earlier on. Why you do what you do is very important, probably just as important as how you do it. And I'll just share a little bit example to illustrate why healthcare needs innovation and why healthcare is fundamentally also about people. So my granddad, he actually runs a shop selling very simple goods, rice, flour, stuff that you need to supply to a restaurant or to a family kitchen. He spent he's an entrepreneur on his own, but back in his day, in the war generation, entrepreneurship was not something that was necessary. You lived or died based on your trade. You really went through a lot of difficult times, whether it's the communist insurgency or whatsoever. So that's a little bit my granddad. He's a really friendly guy. He would typically be sitting on a chair just like this outside the shop, welcoming visitors. And when I would visit him, sometimes he would go to the store next door, which was a traditional candy shop where of course he would load me up with a lot of sweets and chocolates and stuff like that, much to my mom's behest. Obviously, that caused me a lot of obesity. But anyway, as time went by, of course, he enjoyed his food, he enjoyed his durian, his char kway teow, and that took a little bit of a toll on him. He had to go through a number of heart operations and so forth. Eventually, his health went into the decline and became less and less mobile. So you can see here, he has a walking assistance from a walking stick. And this photo was actually taken about 4 years ago, when we realized that actually we may want to start building him a small room on the ground floor so that he didn't have to climb up, because his home was upstairs, in the shop house. So my brother and I, being the only 2 free unskilled people, we started being like carpenters for a day, like hammering together a wall made of plank wood, and essentially making a room. But here's the problem, my family decided that they wanted to build a room for him, but nobody asked him whether he would stay in the room. So to this very day, actually I don't think he stayed at night in that room. So something to note about building for the users. I mean, something that looks great on paper I mean, the business case was fantastic, right? I mean, think about building a room so that you don't have to climb upstairs, you can go to the toilet really easily. So, nah, he didn't like staying there because he felt separated from the rest of the household. He felt isolated, and that idea just didn't go down well with him. So, that's my family, my extended family of aunts. But here's the thing, I mean, stepping aside from this like personal storytelling, here's also a very important representation about demographics. Here you can see the pre-war and war generation. And the next line, you'll see the baby boomers. And the next line, you see everyone who comes after. This is also a representation of the population and demographic pyramid that we are seeing, which predicates to say why we need a technological solution, why we need innovation in healthcare, because people care for people, and in the next 15 years and onwards, we ain't going to have a lot of people to look after these bunch of people in that baby boomer generation. So if you're a person under 50 years old, you better gear up because you're going to be bearing that load. The dependency ratio is staring right at you. So that's a little bit about why Jaga-Me exists, right? Of course, it's a bit about my own personal experience, but of course, the demographic speaks for itself, right? That pressure is waiting for us, and for Singapore alone, we'll be looking at, a fifth of our population being over the age of 65 in 15 years, a fifth, and that means we need to do something. We need to do something different. Yeah. So just coming down from the macro, let's look at some of the micro. Let's look at the user experiences. Let's look at the challenges that they face day to day. So my granddad, he gradually, became slightly weaker. He was now, staying at home most of the time, lying in bed. One day they went for a checkup and found out he had bone cancer. This was about 2-3 years ago, and we realized that hey, actually, we need to think about what end-of-life care was for him. At that time, I had no idea about end-of-life care. At the time, I couldn't probably even spell palliative care. So, but that was what he needed because he consciously wanted to stay at home and to pass away at home. But through that experience, my mom and my aunt were the two most important people in terms of providing that care. So my grandfather had the luxury, if I may say, of having about 4 children to look after him and share that caregiving load. And here are their tools. A calendar, a phone, of course their own bare hands in terms of looking after him, whether it's carrying him, showering him, feeding him, administering the medication. These are the tools of a caregiving trade. And fundamentally, these are also part of the reason why caregivers are stressed. And caregivers are probably one of the hardest jobs you'll get, not only because of the labor that you have to put in, the hard work you have to put in, but also for the fact that, it's just a 24/7 job, right? If you know anyone who's been a caregiver or you've been a caregiver yourself, I'm sure you identify with it. But, as they say, you either have been a caregiver or are a caregiver now or will be a caregiver in the future. So I think this is relevant to everyone. So today's tools of caregiving are left in this age. And Jaga-Me is here to change that. Jaga-Me essentially was built as a company to help caregivers to get care more quickly, more accessibly, and more affordably. But at the same time, stay true to what healthcare is about. People caring for people, and of course quality. I mean, you won't want somebody who was just trained for 4 hours or 5 hours or a day to be looking after your grandfather, would you? You're looking for trained professionals, and that's what Jaga-Me is about, curating trained professionals, having them all over Singapore right now, and actually deploying them through a tech platform interface, which helps people to get care more quickly. In my granddad's experience, he had the blessing of having his family around him, but as you go rewind to that demographic challenge, many of our parents' generation will not have that kind of manpower to back them up. So that's where Jaga-Me came up with this concept of bringing out excess spare capacity in the healthcare professional space and redeploy them into doing micro work so that we can essentially go the extra mile with our healthcare system without topping up basing all our resourcing on foreign manpower for healthcare talent. So that's what Jaga-Me is about, bringing care closer to you anytime, anywhere. So just following the narrative of my grandfather, he eventually, of course, reached a very late stage of care. Here he is with my aunt and uncle and my mom. They celebrated his birthday. He's here. They pretty much brought a hospital to him. Whether it was the hospital bed, the equipment that was necessary for him. I think many people imagine that if they were in such a situation where they, had a long drawn out illness, they had their family around them, they had their friends around them, their pets around them, whatever was meaningful to you. And I think my granddad had that. He was a simple man, he was a kind man. I think what mattered to him was just, going day by day and spending some time with the family. So I think when we think about healthcare, we need to think about not just living longer, but living well. Not just living well, but also thinking about end of life. That's some of the work that the Lian Center has been doing a lot, and Jaga-Me too. We're not a palliative care company only, but we're a healthcare company serving a variety of needs, a spectrum of care. But on one part, partially due to the fact that we've worked with many key partners in the palliative care space, and also we see a lot of acute need in palliative care. We've done a lot of advocacy work in palliative care. One of them being working with the HCA Hospice Care in Singtel to raise funds for needy patients who wanted to go home to spend their last moments. So this is where Jaga-Me's platform and also our operations team help to ensure that care can be delivered in a very short time. So patients who wanted to be terminally discharged and go home for their last moments actually tap on Jaga-Me, and we actually help fund some of that through this crowdfunding campaign supported by Give. So Give is some of you would know, is an online fundraising campaign, and Jaga-Me is essentially helping, apart from palliative care, building up a new joint collaboration whereby we essentially say, hey, people around all over Singapore know other people who may require care, whether it's a geriatric care, whether it's just bringing a loved one to be jaga, as we say. We essentially created now a portal for people to sign up and say, hey, I know somebody who needs care. I think Give and Jaga-Me can come together, help provide that care to that needy patient. So if you guys know anyone, or potentially maybe in the volunteer sector and social services sector, check out jaga.sg/give, and you'll never know what we can do to help them by doing a fundraising campaign and also providing professional care. So that's one of the CSR things that we do as part of reaching out to all people, regardless of their income. As I was sharing with a number of people, we've served people who are billionaires. We've also served people who are in one-room flats. I think healthcare is one of those things which people deserve, and people have something more of a right to access, and that's what Jaga-Me's mission is about. So to sum it all off, I believe that the future of healthcare is at home, and Jaga-Me is building that future. I welcome you guys to support us, and if you know anyone who can be helped or who can join our mission, do let me know. Thanks.
Thanks, Lynn. All right, keep you on stage for one or two questions, perhaps. Any questions for Julian? He's our second last speaker, so the window of asking questions is closing. Any questions for Julian? Yes. Yeah,
given that you actually thought of this idea, that you were inspired from your personal life, can I ask, did you go into this already knowing that there was a gap in the supply? There was an area for you to come in, or how do you come up with that idea?
Well, that's another story. I think you have to stay a longer time. No, just joking. We actually came up with this concept through a confluence of things. of course, I'm not the only founder. I actually have a great team supporting, and of course, one of the